Am I the only one who thought root canals were terrifying? Turns out, it's not as bad as you think. Let's see what really happens. When your tooth gets badly decayed or infected, the inside, called the pulp, can get inflamed. A root canal helps save your tooth instead of losing it. First, your dentist will numb the area so you won't feel pain. They'll put a small cover around the tooth to keep it clean, then make a tiny opening to remove that damaged tissue. Next, they carefully clean and shape the inside using special tools and rinse it out so it's free of germs. After that, they fill the space with a safe material that keeps bacteria out. Finally, you'll get a filling or crown to protect the tooth and get you back to chewing comfortably. You might feel a bit sore for a few days, so stick to soft foods and good brushing habits. See, nothing to fear, just a few steps to save your smile.